Okay, I think it's a good time to get started. I'm just going to read a couple of things and then we'll hand it over to our panelists for this afternoon. Good afternoon, everyone, and thank you all so much for being here for today's Developmental Screening Summer Webinar Series 2024 session, which is Making Connections, Linking Families to Statewide Resources. Today's speakers will provide great information on various statewide resources available to providers and families. Today we have Julie Emery, the PSDT coordinator at the Bureau of Family Health, and also Louisiana's Learn the Science Act Early ambassador. Dr. Lenora Robinson, the manager of the Family Resource Center, and Kaylee Hull, a care coordination consultant, all three with the Bureau of Family Health. Please be advised that the speakers for this session have disclosed that they have no relevant financial relationships. All remaining faculty, Louisiana AAP Education Committee members, and staff have no relevant financial relationships to disclose with ineligible companies whose primary business is producing, marketing, selling, reselling, or distributing healthcare products used by or on patients. All relevant financial relationships have been mitigated. Also on just a quick note, please also note that if you are a social worker, nurse, or nurse practitioner, or physician and would like to receive CE or CME credit for your attendance today, please make sure to attend the webinar in full and complete the evaluation at the conclusion of the session. At the end of today's presentation, we will also have some time to review any questions you might have about the content the presenters are going to present today. Please feel free to type your questions in the chat box or Q&A box, and I'll get to them and I will read them for the presenters. Without further ado, I would like to pass it over to Julie, Lenora, and Kaylee.
Thank you, Teresa. And you were freezing just a bit while you were talking, so I don't know if it was me or not. So if there's any, if it goes out or anything, please let me know. So good afternoon, everyone. Like Teresa said, my name is Julie Emery, and I am the Pediatric Medical Home Coordinator for the Bureau of Family Health, and my colleagues will introduce themselves a little bit later on in the presentation. So today, our kind of high-level overview aim is that we want to really provide a comprehensive overview of resources for Louisiana children and their families, and specifically introduce developmental monitoring and Learn the Science Act Early, a diverse menu of options or resources we have for care coordination, as well as our Family Resource Center. So to get started, first we want to talk about developmental monitoring and those resources that we have available through Learn the Science Act Early. But we do want to encourage, or we want to talk to you a little bit about why we monitor developmental milestones. Monitoring helps families know what skills are typical and what to expect next. It also helps families understand when to act when there is a concern. It helps them to advocate for their kiddos and have that advocacy supported by vetted resources. And of course, we want to identify children early and acknowledge that developmental delays and disabilities are common. In Louisiana, 1 in 4 children have a developmental delay or a special health care needs. And we know that often children aren't identified until kindergarten. And because that early intervention and that early identification supports the most positive and best outcomes, we certainly want to help families to be able to monitor that along with their providers. So a quick note and a little check-in, the difference between developmental surveillance or monitoring, those are used interchangeably a lot, and screening. Monitoring or surveillance is intended to complement developmental screening, and there are no scores associated with it. And so it's ongoing, and it often helps to build relationships between providers and families, because you're having those continuous conversations and celebrating those milestones, as well as looking out for any concern or any reason that we need to act early. Screening, of course, typically is recommended at specific ages, and there are scores and risk categories associated with it. Now, I'd like to introduce you to the CDC's Learn the Signs Act Early initiative. It may be something you're familiar with. And so if you are, I hope you learn more about it today. And if you're not, I'm glad to share this amazing resource with you. It is an initiative of the CDC, and it is free. And it's research-based with parent-friendly resources on child development that helps you as providers to boost family engagement as well as your own professional development. It is evidence-informed, and it includes milestones that most children are expected to achieve at any given age. And so when we say most, our checklist are built on 75% of children typically meet this milestone at this particular age. In the past, if you've used any of our Learn the Signs Act early material, post about 2 years ago, they were built on 50% of children, and they have been revised in 2022 to meet 75%. So it gives a little bit more weight to any of those missed milestones. And if there is a missed milestone, there's a need for discussion or action. It allows that knowledge that if we are seeing a milestone that's missed, then we can go to that next step of screening. And then it also allows for that discussion. And within the checklist, we have some open-ended questions to really find out more and more about that family and the activities of that kiddo. Having those milestones with the 75% avoids that wait and see approach. And so if there is a missing milestone, we don't want to, well, kind of let's wait a little bit longer and see what happens. We really want to go ahead and take the next steps. If you'd like more information on the evidence we use to inform this milestones, you can grab this QR code, and it'll lead you directly to an article that was published that will provide those details of the evidence that we're using. So let's look at specifically a few of the resources that the Learn the Signs Act Early Initiative provides. So this is a look at our checklist. And we have a checklist for every recommended well child visit from 2 months to 5 years of age. And it includes guidance on what to do if there is a developmental concern. It provides early intervention information, reminders about well visits and those recommended developmental screening ages, anticipatory guidance on what to expect by the next age checklist, as well as tips and activities for developmental promotion and early relational health. And so what you're seeing on the screen is the front side and the back side of our checklist. In the state of Louisiana, the Bureau of Family Health, collaborated with Louisiana Department of Education and customized our checklist for each parish in the state. And so the instructions on the screen tell you how you can locate this Act Early map. And once you click on the parish that you're providing services, you'll be able to get this checklist that's customized for your parish. And it will have direct phone numbers for early steps, which is the early intervention for 0 to 3, as well as your school system that will provide those services for 3 and up. Another resource we have is our Milestone Moments booklet. That is going to include all of the checklists starting from 2 months to 5 years, all in one booklet. This can be ordered for free, and I'll tell you where you do that in just a few slides. We also have our Milestone Tracker app, and it continuously grows and is elevated Really every quarter they're making it better and better, and it lately has really gained a lot of attention and traction from families. The app is primarily family facing. However, there is some sections for providers if you want to use it. Um, it includes those milestone checklists, but it also includes videos. If there's a particular milestone that a family may not be familiar with, and so maybe they don't know what the pincher grasp is or something like that, they can click on the video and it'll show what it looks like in action. So that's been really helpful to families. It also includes some tips on things to ask your provider. If you have a concern, it allows you to put in information for your well child visits, like those height and weight stats. And then it also even provides some next steps if a family is using this outside of maybe a well child visit. It helps them connect to resources if they do have a concern. Providers can order, or anyone can order, some flyers on our website. They come in packs of 100 and 150 that you can get to your office so you can hand out to families, have them in waiting rooms, have those in hand so you can help families get connected to this resource. We also have books that are free. We have a book for the age of 1, 2, and 3. They're available in both English and Spanish. Our checklists are available in multiple languages. In these books, they are developmentally appropriate for that age, but there's also some notes for families that kind of highlight when those developmental milestones are showing up in the book. So it's kind of dual purpose. Providers can order these for free as well as families. So to order these materials, you can go to our website, the Learn the Signs Act Early website, and I will drop this in the chat in just a minute. You can go to free materials and you'll be able to see the different options that you can have sent directly to you. And lastly, before we shift over to our next presenter, I wanted to put in a quick plug for the Vroom app as well. We encourage providers to share the Vroom app with the families that they serve because it includes a lot of relation-based activities that's built around science and really encourages families to use those everyday moments and turn those into brain-building moments. So a great opportunity to influence that development with families as well. So we'll have time for questions at the end, but at this time, I'm going to turn it over to my colleague, Kaylee.
Thank you, Julie. Hi, everybody. Good afternoon. My name is Kaylee Hall. I'm the Care Coordination Consultant with the Bureau of Family Health. So we know that identified risk without a referral is not going to be effective, and that's really where care coordination and care coordination resources comes in. So the supported outcomes of effective care coordination is going to be that access to coordinated, ongoing, comprehensive care within the medical home setting, that family-centered care, benefits, information, and linkage, early and continuous screening for special healthcare needs, organized community services for easy use, and then that transition from youth to adult healthcare. The Bureau of Family Health continues to look for the right services and solutions for Louisiana's children, and I'm excited to share out some basic, sort of quick start care coordination resources and referrals on today's call. Before we jump in, I do want to ground us with a definition. So the operational definition that the Bureau has adopted for pediatric care coordination is going to be that family-centered, assessment-driven, team-based activity designed to meet the needs of children and youth while enhancing the caregiving capabilities of families. Care coordination addresses interrelated medical, oral, social, developmental, behavioral, educational, and financial needs in order to achieve optimal health and wellness outcomes. So our priority referral for ages 0 to 3, as Julie had also mentioned, is going to be Early Steps. So Early Steps is a statewide early intervention program. Early Steps provides services to families with infants and toddlers. This is going to be for your birth to 3 years. who have the medical condition that's likely to result in a developmental delay, or who already have a developmental delay that's been identified. And there are offices across the state. It's important to note that referrals can come from anyone. It can be a provider placing a referral. It can also be a parent who maybe has concerns about their child's development, who calls in a referral as well. There is a two-sided referral form. I did want to provide a snapshot on today's call so you're familiar with it if you haven't used it already. This is going to be a snapshot of the front side. And then we also have a back side included, which includes a health summary for that child. Once a referral is received, Early Steps will contact the family for an intake assessment and an evaluation to determine if a child meets that criteria for services. So when there's identified risk after 30 months, children will begin the process of transitioning out of Early Steps, and they're now going to go through the local school board through child search. So whatever parish where that child resides. It is also important to note that the referral processes are different, a little bit different for every parish. Just for an example, Jefferson Parish, I know they take referrals typically by phone, where Orleans Parish is an online referral form. So just check the referral steps for your parish. But at age 3, children who are receiving those early step services should transition to child search when services are still indicated. The school board will do their own developmental evaluation to initiate those services. So checking in with the family about early intervention plans at that 30 and 36-month well visit is definitely good practice to ensure that children that require those continued interventional services are successfully transitioned from Early Steps over to the school board. We wanted to include a list of autism evaluation sites. Now, these are typically in the greater New Orleans area. However, there are, of course, providers throughout the state. So always check with the child's insurance provider for other options closer to the parish where they reside. The Bureau does offer early childhood development resource guides and referral tip sheets. So the Bureau has compiled some of the most relevant and pertinent resources for each region of our state. These guides in particular, they are 3-part. They highlight resources for families based on general and social development, autism, and family wellness. Providers and families can simply click on the region of the interactive map to access these resource guides. Additionally, on the same page, providers and their staff can view instructional videos on how to use and distribute these guides to families. On a broader level, the Bureau also has pediatric referral region-specific resource guides. So these are going to be local resource guides with those recommended pediatric and adolescent services and programs that's also been created. So each of these 9 guides contain contact information, eligibility requirements, and a brief description of services offered by the organization. So again, providers, support staff, families, they can click on that interactive map and download a PDF version of the regional resource guide for the selected area where the family resides. These guides are updated at least annually, and they're just a very easy to use, easy to hand out resource guide, all-in-one information for your families. Did want to take a few slides just to highlight some key community resources that, if they're not on your radar already, may be important for your family. So for crisis support, there is Vialink. Vialink does provide crisis support and connects people to resources and services. These are going to be services that are provided over the phone, text, and online chat. They're available 24/7, 365 days a year. For school readiness, we wanted to highlight Early Head Start and Head Start. So Early Head Start for the 0 to 3 population and Head Start for the 3 to 5. Early Head Start and Head Start, these are federal programs that promote school readiness of children from birth to 5 from low-income families by enhancing cognitive, social, and emotional development. In addition, we have the Child Care Assistance Program. That's going to be our CCAP. CCAP is also for low-income working families who are working at least 20 hours per week or attending school. Additional key community resource guides. Of course, we have our nutritional programs. We have WIC. WIC is going to be that safeguard for the health of low-income, pregnant, postpartum, and breastfeeding women, infant, and children. WIC also serves those up to age 5 who are at a nutritional risk by providing foods and supplemental diet to supplement diets. We have SNAP, or also food stamps. The Supplemental Nutrition Assistance Program, this is going to provide those monthly benefits that help eligible low-income households to buy the food they need to also have good health. We do have resources available for providers as well for screening for food insecurity that are going to be available within the slides. We also wanted to highlight medical transportation. So Medicaid does offer transportation through different brokers, depending on which MCO the family has. This non-emergent transport can be scheduled 48 hours in advance for routine medical appointments. And then for children and youth with special health care needs, they may qualify for supplemental security income. SSI provides monthly payments for people with disabilities and older adults who have little or no income or resources. So adults and children might be eligible for SSI if they have little or no income, little or no resources, and a disability, blindness, or age 65 and older. Applications can be completed online and also in person through an appointment at the local SSI office. Again, for children and youth with special healthcare needs, we did want to highlight the Office for Citizens with Developmental Disabilities, or OCDD. OCDD is responsible for providing services and supports to individuals with developmental disabilities in Louisiana, and they do act as that single point of entry. So there are multiple offices throughout the state. Under the OCDD umbrella, you have your Early Steps program, flexible family funds, home and community-based services, individual and family support, support coordination, as well as tiered waiver services. Part of the work of the Bureau has been to also expand pediatric and other clinical practices capacities to provide services to Louisiana families. The Bureau has developed 3 provider toolkits: our developmental screening toolkit, care coordination toolkit, and our youth health transition toolkit. These evidence-based toolkits are for healthcare or social service professionals, whether it's physicians, nurses, social workers, clinic managers, support staff, who really want to integrate or expand services within their regular clinic practice. The toolkits are based on clinical practice guidelines from national experts, as well as lessons learned from the field. They can provide a guide to help assess, plan, and implement services tailored to your clinic needs and capacity. They are fully customizable, and many of the resources and referral guides that we talked about on today's call can actually be found within the resource section of these toolkits. I do encourage you to check out the toolkits. As you navigate, you will find many different resources available within them. We also have a team of experts available to provide implementation training and support. So on the right side of the screen, you're going to see the ITS form that can be filled out. Again, and these are also all available online, so you'll see this form online as well. If you have any specific questions or specific clinic needs, our team is there to provide guidance, help with decision-making along the way, problem solving, and also coach through implementing changes in your practice. Just as a reminder that any QI quality improvement project around care coordination, developmental screening, and youth health transition can serve as a component of maintenance certification credit. The Bureau does also sponsor a virtual statewide resource center to help identify and connect families to resources and services in their community. This is through the Family Resource Center, but I'm going to pause right here as I'm going to do a handoff to Dr. Lenora Robinson, who is the Family Resource Center manager. Thank you all so much.
Good afternoon, and thank you, Katie. I am Lenora Robinson, the program manager for the Family Resource Center, and I, in my own little world, call them Team Awesome. As you see, this is my staff. I have Miss Claudia Lawson, who is our resource specialist, Claire Brown, who is our resource specialist, also part-time, but she was the brick and mortar, a part of the team that was the brick and mortar in the Children's Hospital. So she brings us wisdom and knowledge as we develop the Family Resource Center and grow to be the virtual resource center point of access for the state of Louisiana. Kaylee Hall is our care coordinator, as you've met and had the opportunity to see her wonderful work in care coordination. And Miss Tiffany Williams, who brings us just a wealth of knowledge from the clinic aspect. Like I said, we began as a brick and mortar children's hospital, serving primarily New Orleans and the greater New Orleans area. And the one thing COVID did that was great, it gave cause for us to become a virtual resource center, which gave us the opportunity to serve all of Louisiana in the capacity of providing resources and connecting people throughout the state of Louisiana to needed services, especially those families with children born with special health care needs. Okay, and in addition to us becoming the statewide resource center under the Bureau of Family Health, we found it advantageous to build a partnership with all programs within the Bureau of Family Health. And this gave us the opportunity to understand better what these programs did and how they served the people of Louisiana, and us provide a source of outreach and connectivity for those families out into the state. We connect them to resources and services in all regions of the state of Louisiana and help bridge some of the gaps that exist in their health and in their reaching needed resources. This is a picture of the programs that exist under the BFH. And as I stated, we were given the task of collaborating and better understanding the needs that each one of these programs were responsible for handling in the health realm and sector throughout the state. And where we partnered, we became reciprocal. We were able to take on some of those connectivity points that they are unable to handle for various reasons. Everybody does not fit into their programs. We're able to provide at least resources that will steer them on the way and connect them to outside sources that would better enhance a quality life, especially those families that were dealing with special healthcare needs, because usually they're the people that are left out or receive subservice or unable to find services that actually fit their needs. So these are our programs. And to give you a little bit of idea of the Family Resource Center, we're a statewide virtual resource center designed, of course, under the Bureau of Family Health. And we service all families, but we're especially given the charge to serve families with special healthcare needs that are identified through surveillance. And I'm proud to say we started out right after COVID. So we had about a year to 2-year backlog. Now we're almost to the point where we're doing what we call live hands-on touching, which means we're almost to the point where we're within 90 days of those births. So we're able to actually get in and use some of our resources like care coordination to actually guide them to needed resources, and able to use services like developmental screening to identify these discrepancies and these challenges much early so that they can start getting services that will enhance their quality of life and make outcomes a little better. We are growing when it comes to communicating and building relationships with providers. And we're doing as much as we can because so many times providers know the problem, but don't know the answer or don't know how to find solutions and guidance and finding resources needed to accommodate their families. So our relationship with providers growing in leaps and bounds. So not only do we serve families throughout the state, families with special healthcare needs, but we're now wanting to become and growing to become a source for providers so that they don't just have to say, I have a problem. This family needs something, but we don't know how to connect them to it. We want to be that somebody that connects them to it. And as you see, we have a family-friendly card with QR code. We deal with everything from health and mental health, food sources, insurance. We want to just be that everything, if they have a need, we want to be able to provide it. And if we don't have it readily, we want to be able to research it and reach back out to them and let them know this is the direction we need to go in. Let us help you get there. And last but not least, I want to give you a brief overview on how the referral happens. Like I said, we have the QR code, we have the card that spells out a framework for those services and resources we're able to provide. We also have a resource main number. Now, the good thing about that main number, regardless if it's during our work hours, before or after our work hours, if it's after the work hours, before the work hours, and you leave a message, it automatically emails us that there's a message in a family in need or someone in need of resources and services. We also have an email address where it comes directly into the FRC BFH email, and they're checked daily and often. And of course, we have the QR code so that we are now in compliance with the population we primarily deal with, which happens to be families in maternal within the age-bearing category, within the age-bearing sector. So we try to stay as relevant as we can. One thing we have added, we have a small texting capacity. We're trying to increase that so that we are more effective with the population that we primarily deal with. And we're ready for questions because your questions and suggestions make us better.
Thank you so much. If y'all have any questions, you can put them in the Q&A section or the chat. And I'm going to check and see right now if we have any. And if you have some later after you've kind of had time to review everything and you want to ask a question at a later date, please feel free to email any of the presenters today and they'd be happy to answer any of your questions. Let's see, we'll wait. I don't see any questions in the chat right now. We can wait a few minutes and see if there are any. Don't see any yet. In the meantime, while we're waiting for questions, please make sure if you are wanting to receive that CE or CME credit that you fill out the evaluation form at the conclusion of the webinar. It'll pop up once I end it, and it'll also be a link in your email tomorrow from the Zoom. And also, if you have some extra time, we'd love for you to fill out our provider survey. And I'll send that link as well to everyone. I don't see any. Oh, let's see. Do we have one? No, that's a thank you to everybody for presenting today. Looks like you guys were very thorough. I don't have any questions today. All right, well, thank you very much, everyone. And please make sure to send us any questions that you have and fill out those evaluations and surveys. Thank you so much. Have a wonderful day. Bye-bye.